Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and today I will be talking about a global initiative for chronic obstructive lung disease 2023 report, the Gold Executive Summary. Now, lung diseases we all know have become more prominent since the pandemic. To create more awareness about them is the need. The Global Initiative for Chronic Obstructive Lung Disease, as we all call it, the COPD, has published the complete 2023 Gold report. It contains important changes compared to earlier versions and incorporates 387 new references. The study that I'm talking about in the Journal of the Pan-African Thoracic Society, which is published by Scientific Scholar, presents an executive summary of this Gold 2023 report that summarizes aspects that are relevant from a clinician's perspective and updates evidence published since the prior executive summary that was published in 2017. The definition of a disease should only include the characteristics that distinguish it from other diseases. Accordingly, the Gold 2023 proposes a new definition of COPD that, at variance with previous documents, focuses exclusively on these characteristics, especially separately from its epidemiology, causes, risk factors, and diagnostic criteria. The Gold 2023 defines COPD as a heterogeneous lung condition characterized by chronic respiratory symptoms, including dyspnea, cough, expectoration, and even exacerbations due to abnormalities of the airways that could either be bronchitis, bronchiolitis, and even alveoli, that is emphysema, that causes persistent, often progressive airflow obstruction. Now, factors like cigarette smoking is a key environmental risk factor for COPD. Cigarette smokers have a higher prevalence of respiratory symptoms and lung function abnormalities, a greater COPD mortality rate than non-smokers. Yet, fewer than 50% of heavy smokers develop this condition. Occupational exposures, including organic and inorganic dusts, chemical agents, and fumes, are underappreciated environmental risk factors for COPD. Air pollution, which typically consists of particulate matter, ozone, oxides of nitrogen or sulfur, heavy metals, and other greenhouse gases, is a major worldwide cause of COPD, responsible for 50% of the attributable risk for COPD. Genetic factors are the most relevant risk factors for COPD identified are the mutations in SERPINA1 leading to alpha-1 antitrypsin deficiency, a major circulating inhibitor of serine proteases. The lungs grow and mature until about 20 to 25 years of age, which is often earlier in females when lung function reaches its peak. This is followed by a relatively short plateau and a final phase of mild lung function decline due to physiological lung aging. So, lung diseases are common in both males and females. Many different studies have reported that asthma and atopy in infancy may be a significant risk factor in adulthood. Severe lung infections in childhood have also been associated with reduced lung function and increased respiratory symptoms in adulthood. COPD, as we talk about it, is a common, preventable, and treatable disease, but extensive underdiagnosis and misdiagnosis often leads to patients receiving no treatment or even incorrect treatment. The realization that environmental factors other than tobacco smoking can contribute to COPD, that it can start early in life and also affect young individuals, and that there are precursor conditions opens new windows of opportunity for its prevention, early diagnosis, and prompt and appropriate therapeutic intervention. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.